Could a long-used anti-malaria drug be a potential weapon against coronavirus? Hydroxychloroquine and related drugs have been boosted as a game changer by US President Donald Trump and President Jair Bolsonaro of Brazil. But doctors aren't so sure. Some patients stricken with Covid-19 have improved after taking the drug. But a recent study suggests the medication could lead to heart problems.
Is there a medicine that fights coronavirus? Some politicians are convinced that hydroxychloroquine is a miracle cure. Used for decades to treat malaria, some believe it also works for Covid-19. Brazilian President Jair Bolsonaro also believes that hydroxychloroquine works.
There
is no coronavirus vaccination or highly effective medicine. But I still think hydroxychloroquine is quite effective. It'll make the virus disappear quickly.
US President Donald Trump also believes hydroxychloroquine is the key to beating the pandemic. But health experts warn of considerable risks.
Hydroxychloroquine can help, but not in the initial phase of a COVID-19 infection. It can only help if the patient is already in a critical condition. But if it's used in the beginning phase, it can cause heart problems or even be fatal.
A study quoted in the New York Times says the same. There have been deadly complications during testing in the Brazilian city of Manaus. There, 11 out of 81 coronavirus patients who had taken a related drug, chloroquine, died of irregular heart rates. Scientists are urging caution, saying the malaria medicine needs to be thoroughly tested and approved. That was also the view of Bolsonaro's health minister, but the Brazilian president fired him partly due to their disagreement over the drug.
We're seeing huge amounts of people being infected with a new virus. We experts are still very doubtful over the issue of the proper medicine, but stupid politicians think they know the truth.
The debate over hydroxychloroquine is being driven by politics and not public health. That's not a good sign in the midst of the coronavirus pandemic.
Okay, joining me for more on this is Anna Jean Kaiser. She's a journalist in Rio de Janeiro. Hello to you, Anna Jean. Why is President Bolsonaro pushing for the use of anti-malaria drugs to treat COVID-19?
You know, for Bolsonaro, he's really trying to minimize the risk that COVID-19 presents to Brazil. You know, Bolsonaro, the economy is hugely important to him. So he's really taken the stance that, you know, people need to be going back to work. And this, you know, he's called coronavirus just a little flu. And, you know, he takes the stance that, like, the drug means that there's a solution and that there's really no problem here. So, and another big part of that is that Donald Trump has endorsed chloroquine. You know, Bolsonaro takes a lot of tips from Donald Trump's playbook. He wants to sort of appear as anti-establishment, saying that the WHO is over-exaggerating this threat. So, you know, it's both a combination of that. He wants to minimize the threat and also sort of likes to, you know, follow Donald Trump's political playbook.
Another thing is that President Bolsonaro says he wants the social isolation measures to end this week. Does he have support of the Brazilian people?
No, he really doesn't, actually. Only 18% of Brazilians in a recent poll said that they were against the stay-at-home orders. So really the large majority of people are in favor of staying at home. His health minister, who was fired recently, who had been advocating for the stay-at-home order, he was incredibly popular. The governors in Brazil are also issuing stay-at-home orders. So Bolsonaro is really becoming pretty isolated politically, both from his supporters and from his fellow politicians, because he is calling for Brazil to sort of go back to work. So it's definitely lost him a lot of, sort of more centrist supporters that helped him get elected, and, a lot of the political allies that he has. So he's definitely, he's making a pretty risky bet by trying to reopen Brazil so soon.
Just talk to us about the lockdown measures that are in place in cities like Rio, where you are. Are people adhering to the social restrictive measures?
Yeah, a recent poll has said that around 60% of Brazilians are, following the rules, which currently are that you should be staying at home. You can only go out to go to the grocery store, the pharmacy, and you are allowed to take walks. So around 60% of Brazilians are following that, and around 18% are doing a full lockdown, not leaving the house for anything. So, a good portion of the population is taking this quite seriously and listening to the guidelines from the WHO and from governors and are staying at home.
All right, that's Anna Jean Kaiser, journalist in Rio de Janeiro. Thank you.